On behalf of Boulder Community Health, it's my pleasure to introduce this evening's speaker, Aditya Yerrapragada. Dr. Yerrapragada is fellowship-trained orthopedic foot and ankle surgeon. Having completed extensive training in foot and ankle surgery, he is highly skilled in treating a broad range of conditions of the foot, ankle, and lower leg. He uses the most modern methods of treatment in minimally invasive surgery. He sees patients at Boulder Center for Orthopedics and Spine in Boulder and Lafayette, and Yuma District Hospitals and Clinics in Yuma, Colorado. Welcome, Dr. Yerrapragada.
Thank you, Karen, and thank you everyone for taking part in this lecture and being there remotely from home. And look forward to educating everyone on some foot and ankle injuries associated with hiking. So, as Karen mentioned, my name is Aditya Yerrapragada. I'm an orthopedic foot and ankle surgeon, and what I'm going to talk about tonight is foot and ankle hiking injuries, how to prevent them, and how to treat them. I'm going to first just go over a little bit about myself. I've originally started my training. I did undergrad at the University of Texas in Austin. I did medical school at the University of Louisville, School of Medicine in Louisville, Kentucky. I did my orthopedic surgery residency in Seattle, Washington at the University of Washington. And then I spent an extra year of specific training focused in foot and ankle surgery at MedStar Union Memorial Hospital in Baltimore, Maryland. When it comes to specialties and things that I treat, I essentially treat all things foot and ankle, whether it's Achilles related, arthritis related, bunion correction, cartilage repair, deformity correction, fracture care, ankle replacement. I practice the gamut of foot and ankle surgery, and I enjoy every bit of it, frankly, because I love the diversity and the different types of things that I can do to help patients. When I'm not operating, I also enjoy doing the things a lot of Coloradoans enjoy doing as well. I enjoy snowboarding, hiking, and spending time with my wife and my two sons. So what I'm going to focus on today in this lecture, here's a little overview. I'll do a brief overview of the anatomy of the foot and ankle. I'll go over some common hiking related conditions that I see, some of which are traumatic and some of which are overuse related. I'll go over some non-surgical treatments for each of them, as well as some operative treatments. And then at the end, I'll focus on preventative care, ways that patients can prevent these types of injuries from happening and allow everyone to stay as active as everyone wants to be. So first, I'll focus on the anatomy of the foot and ankle. As you might imagine, the foot and ankle is a very complex sets of bones, joints, and ligaments and tendons that all work together to allow us to bear our entire body weight safely and structurally. And there's a lot of complicated interconnections between them. There's at least 30 bones in the foot. People have more sometimes. People have extra bones. And these 30 bones articulate in over 33 different ways. So there's 33 different joints that move and coordinate motion together to allow our feet to work as they should. Along with these bones and joints, there's over 100 different muscles, tendons, ligaments, soft tissue connections, and overall it's a complicated mesh of soft tissues and bones that allow us to do what we want to do. Now let me go over some common hiking related conditions that I typically see in my practice. So, as you might imagine, hiking involves a lot of long distances, often involves uneven surfaces, and this is something that will predispose patients to developing different types of injuries. As I mentioned before, the common injuries I see, I can coordinate them into two different buckets, either overuse type injuries from repetitive activity or traumatic from a singular incident that results in an injury. I'll start with the overuse type first, and the most common thing I see is different types of tendonitis of the foot and ankle. So what is tendonitis? Inflammation of tendons resulting in pain and swelling. And what tendons are the connection between our muscles and our bones. When we fire our muscles in order to move bones, it activates through our tendons. Common locations of tendonitis involve the peroneal tendons, which are tendons that are on the outside of our ankle joint. They allow us to evert and bring our foot out and up. On the other side of the ankle, you have your posterior tibial tendon, which has the opposite action, which allows our ankle to invert and point down. And another common location is the Achilles tendon. The Achilles is the strongest and largest tendon in our lower extremity and bears our entire body weight, and oftentimes that can get inflamed from overuse type activities. Like I mentioned, it's overuse related and it's activity related pain, meaning it oftentimes gets better with rest. So if you're not on your foot or your ankle when you're resting, typically that does help the condition improve. It can often be associated with swelling over the affected tendon, and underlying that tendinitis and inflammation, there may also be some partial tearing present, and that's not necessarily a traumatic tear, but it's an overuse degenerative type tear where you can get small little micro tears in the tendon, not associated with the rupture, but that can result in inflammation. These types of tendinitis often respond to anti-inflammatories, and like I mentioned before, often responds to rest. Another common condition that I and a lot of people have encountered over our time here is plantar fasciitis. So the plantar fascia is a thick band of tissue that supports the arch of our foot. It runs from the heel of the bottom of the foot all the way into the toes, and it's a thick, wide, broad band. Its repetitive overuse can result in micro tears of the plantar fascia, causing inflammation. One of the most common spots of pain is on the heel and the bottom part of your foot, right where this diagram is demonstrating, kind of in this area here. And again, like I mentioned, very common condition, one of the most common things I see. Pain is usually in the bottom of the heel or the plantar surface of the heel. It can also be in the arch of the foot, but not as commonly. Oftentimes the worst pain is in the morning after prolonged sitting, but it can also develop after prolonged ambulation. This is the type of thing I'll see in folks that are avid hikers, is with longer distances and prolonged hiking, they can develop these type of plantar fasciitis over time. Risk factors is increased body weight can predispose you to developing increased pain. Calf tightness is a common condition for this, is because our calf and our plantar fascia, they work together to allow that heel-toe motion of ambulation, and if one is tight, the other has to work harder. So as a result, you can develop some inflammation in your plantar fascia. And here, endurance activities, dancing, running, hiking, these things can cause plantar fasciitis to develop. Another condition, not a soft tissue related condition, is stress fracture. Stress fracture is an overuse-related fracture. Repetitive micro-trauma results in development of a fracture. It can be anywhere in the foot. Typically, the most common location that I see is in the metatarsal bone, but it can also be in the calcaneus, which is the heel bone, or the fibula, which is one of the ankle bones, the lateral or outside part of your ankle. Risk factors for developing a stress fracture: poor nutrition or low vitamin D can result in development of a stress fracture. Because calcium and vitamin D are the building blocks of bone, and if vitamin D is low, your bone doesn't remodel and heal the same way it normally does. And repetitive high-impact activity, which you can have in hiking, especially over these uneven surfaces, can result in development of a stress fracture. The early signs or the early stages of a stress fracture, x-rays are often normal. So you may get an x-ray and it's negative, but oftentimes it's the focal pain that you feel on exam right over one spot. That's a potential indication of a stress fracture. Over time, though, the fractures can start to show up on an x-ray, and here's an example here where you see this cloud of bone developing in the area of an otherwise normal appearing bone. That's an indication that there's a stress fracture there that your body's trying to heal with that cloud of bone. You're going to have pain with activity or weight bearing that often gets better with rest, and oftentimes there's associated swelling present as well. Now I'm going to switch gears a little bit and talk about traumatic injuries that you can develop from hiking. The most common thing that I see in practice is ankle sprains. And as you might imagine, with all the different rocky or uneven surfaces associated with hiking, it's just one wrong step, not paying attention, you can twist your foot. It often results from an inversion injury, which is demonstrated here, where the outside or lateral part of your foot or ankle gets stretched and pulled. And that sudden motion with our full body weight can result in sprains of the ligaments on the outside of the ankle. No one sprain is the same. It's a spectrum. So some are mild, easy to get over after a couple days. Some can be severe, which takes several weeks to a few months to fully get over. On exam, on your foot and ankle, you'll see bruising, swelling, and significant pain. and it's going to be often on the lateral or outside part of your ankle. You may or may not be able to bear weight. And the difficult thing when it comes to sprains like this is determining whether or not there's a fracture. Oftentimes fractures can feel the same as a sprain can. So when in doubt, I always recommend getting an x-ray, whether that's with your primary care doctor, going to an urgent care, or seeing a specialist, is to get an x-ray to confirm that there isn't a fracture associated with it, because sometimes that can change the management. Now, talking about fractures can also happen with hiking injuries, especially when it involves uneven surfaces, but then a fall. If you're on a graded slope and you have a fall and you end up sliding down or going down further, you can get some higher energy mechanism of injury resulting in fractures. They can involve any bone in the foot and ankle. Here are different examples. The picture on the left here, this is a fracture involving both bones of the ankle, both the fibula and the tibia. You can see are clearly broken. In the middle picture, you see signs of what's called a Jones fracture, or a fracture of the fifth metatarsal in the specific region. You can see that subtle line in that fifth metatarsal bone indicating fracture. Or you can even get a fracture of your heel bone if it's a high enough mechanism, fall from height, fall from distance, resulting in a fracture of your heel bone. You can see here there's irregularities in the surfaces of the bone here that indicates there's a heel bone or calcaneus fracture there. Just like with a sprain or a bad sprain, you can get swelling, bruising, and pain. Now with fractures, more typically, you're unable to bear weight, but being able to walk on it and bearing weight does not exclude you from having a fracture. A lot of us are tough out there. A lot of folks here are active, tough, and have a high pain tolerance. And you can sometimes get away with walking on a fracture. And oftentimes I have folks walking into clinic with a broken bone and didn't even know it. What I would recommend, though, is getting an x-ray. So again, when in doubt, get an x-ray, whoever that may be, but it's important to get one. And depending on the type of fracture and the location, treatment can be operative or non-operative. Another injury I see relatively regularly is an Achilles rupture. So the Achilles tendon, mentioned strongest tendon in the lower extremity, and it's the injury results from sudden dorsiflexion of the ankle. By dorsiflexion, I mean your ankle coming up. So that could be from a fall, that can be from trying to step up on a surface and losing your footing, or trying an explosive move. So that could be a sports participation and trying to push off on the foot. That results in a sudden pop. What people often feel is like someone hit them in the back of the leg, or someone, clubbed them in the back, and they turn around, no one's there. And that's often a common story that I hear from patients. It involves typically higher intensity activities, trail running, sports, and a lot of technical hiking. On exam, you'll have swelling all around the back of your Achilles tendon with a palpable defect. You can see here the ankle on the left is significantly swollen compared to the ankle on the right, where you can see a nice defined Achilles tendon. What's also interesting to note is the station and the position of the foot. With an intact tendon that's working, your foot has a natural plantar flexion or pointed down position. But when that tendon is ruptured, there's nothing there to push your tendon down, so push your ankle down. So your ankle wants to ride up instead of this kind of neutral position here. What's also kind of misleading or difficult to assess is you can often bear weight. And after the initial injury, Achilles ruptures are often not painful. So a lot of folks are come in my clinic walking on Achilles ruptures, not knowing that it happened after a twist or a fall while hiking, and they thought nothing of it, and they keep walking on it. So it's important to have an evaluation if you had an injury that caused you limitations. So with these kind of general conditions, I'll talk about some non-surgical treatments associated with them. The first line treatment for any condition is the age-old RICE treatment, rest, ice, compression, and elevation. These are all important to decrease and try to minimize the presence of inflammation. Now, inflammation in a lot of ways is good. That's our body's natural healing response, and it's the beginning of the healing cascade. But ultimately, in order to try to minimize pain and minimize symptoms, you're going to want to try to decrease the inflammation, because what allows you to get back to function eventually after an injury is to keep that inflammation under control. So by doing so early is a good way to try the healing process to accelerate it. Like I mentioned, rest is probably the most important thing, and that's the hardest thing to preach here in Colorado, especially Boulder. Is everyone's active, they have their passions, their sports, hiking in particular, and it's really hard to slow us down. So, but these conditions, especially overuse type conditions, is our body's way of telling us that, hey, we need to slow down. There's something that our body isn't able to keep up with, and we need to rest it. Ice is often more beneficial than heat in the acute or immediate phase of an injury, because ice can really help calm down the swelling and decrease inflammation. Compression also helps with swelling, and oftentimes one of the preventative things I'd recommend to patients that, who are hiking and have these type of nagging tendonitis or overuse conditions is to wear a compression sock or a compression stocking to help minimize swelling, to help prevent the generation of inflammation as you're being active and as you're working. Elevation also helps too, similarly with the swelling and the pain, and it's just intuitive in terms of the higher you hold your foot, ideally above the level of the heart, gravity will do a lot of the work for you to help decrease the swelling in the fluid. Some parts of the body are harder to elevate. It's difficult to elevate the hip or the knee, but the ankle and the foot is relatively easy to do. Just you gotta be on a flat surface or recliner and prop it up on several pillows, different cushions, that type of thing. The next step up from that are anti-inflammatories, and I know a lot of folks aren't super keen on taking medications when needed, but these are over-the-counter, relatively safe medications that, unless you have either an allergy or potentially a stomach ulcer or GI issue or a bleeding issue, those are pretty reliable in helping calm down inflammation. The common anti-inflammatory that we use are NSAIDs, or non-steroidal anti-inflammatory drugs. These are Advil or ibuprofen or naproxen, which is Aleve. There's an oral version, like I mentioned, that we commonly use, and that can cause GI upset. It typically doesn't happen after immediate use. It's usually after long, consistent, prolonged use that you get the GI upset, but it's important to know your history, and if you had a history of either reflux or stomach ulcers, to avoid taking it. But there is a topical version that exists that's been recently made over the counter. It's called Voltaren gel, or the generic name is diclofenac gel, and that's often what I recommend a lot of my patients for in the foot and ankle, because there's not a lot of tissue between the skin and the tendon, or skin and the bone in the foot, so that allows good absorption through the topical nature of the medication. It avoids damaging your gut and causing any stomach ulcers and issues. Typically, I have folks start a 2 to 3 week course of this consistently to maintain a baseline level of inflammation, to calm down inflammation, to try to start the healing process. The next level of treatment for most conditions is some type of immobilization. That may be a cast, it may be a boot, it may be a brace, but it's helpful in the initial stages, because the theory behind it is when you're inflamed and painful and sore, motion aggravates it. So we want to immobilize you to let your body do its thing and heal. With most conditions, I let people weight bear. Depending on the fracture, I may not, but most conditions weight bearing is allowed. And it's just in a controlled manner, but the boot prevents that rotational or motion across the joint, which can make things worse and inflame things. The boots or cast or brace, whatever we put you in, it does cause stiffness, and that's by design. So we have to balance this need for healing and rest with the fact that stiffness will set on. And I'll talk a little later about ways to overcome that stiffness, but that does happen in the short term. That can be overcome down the line. Type of immobilization depends on the severity of condition. So in general, I slowly step you down from the highest level of mobilization down. So if I start you in a boot, we decrease you down to a brace. If you start in a brace, we decrease down to supportive types of shoes, which I'll talk about a little bit. But there's a step down, because there's also a risk of causing an injury if we advance you too far. We don't want you to be too aggressive, because that can also hurt you too. So there's a little bit of a science in the way we step you down and try to get you back to hiking. I'll briefly talk over some operative treatments. This isn't going to be the focus of my talk, but I want to include that there are, if it comes to it, operative ways to treat conditions if all the things we try don't work and don't provide you relief. So for different types of tendonitis, there's different things we can do. Perineal tendonitis is a common condition that I see and a common condition that I treat with surgery. And perineal tendonitis is often associated with tears or instability, meaning the tendons are popping in and out of their groove. You can see on these pictures here, that's an example of a perineal tendon tear right through the mid-substance. And you can imagine, as that tendon glides around your ankle, it'll catch on bone or catch on soft tissue, causing pain and discomfort. The way we treat it is very intuitive. You stitch it up with suture. So you eliminate that tear by binding it together to with suture, so that your body eventually heals that up. And part of the process is what we call tubularizing. So instead of a flat tendon, you make it a tube to allow it to glide like it's supposed to and not catch on things. The other type of common operative treatment that I do is Achilles tendon rupture, Achilles tendon repair. So you can actually manage an Achilles tendon rupture both non-surgically and surgically. And there are a lot of studies have shown that both non-operative and operative management, patients have similar outcomes. There are pros and cons to each. With surgical management, you can get away with a lower re-rupture rate because, it intuitively makes sense if you're going in there and physically reattaching the tendon. It's a little stronger, so lower re-rupture rate. But it has the downside of going under surgery. So you have an incision that has to heal, you go under anesthesia, and it carries with this those small risks. On the flip side, with non-operative management, you can avoid those risks of surgery, having an incision that has to heal and going under anesthesia. But the way your body heals is through scar tissue, and that can have a little higher re-rupture rate compared to surgical management. But these are different techniques and different ways to fix Achilles ruptures. The way I fix it nowadays is with the minimally invasive technique, with smaller incisions, percutaneous grabbing of the tendon and anchoring it to the bone with anchors as described here. Ankle sprain surgery is one of the more common things I see as well. So not every ankle sprain needs a surgery. In fact, the majority don't. But the folks that end up needing the surgery are ones that had a bad sprain. They've gone through all of the immobilization, therapy, rehab, and despite that, they either still keep rolling their ankle or still have persistent pain. And when it comes down to it, then we go in and repair the ligament. So we physically open you up and reattach that ligament back to the bone and make it as tight as you can, frankly, because your body only loosens over time, it doesn't tighten over time. So by making it really tight, you stabilize the ankle, and then after recovery, people are able to get back to what they're doing. Fracture surgery is some of the more complicated but very fun surgeries that I do. Every fracture is different, no fracture is the same, and they all require different types of techniques and different types of fixation. And you can see here in the top left, this is a patient who had an ankle fracture and a talus fracture requiring screws to fix it. Patient down here had a calcaneus fracture, heel bone fracture that needed surgery to fix, and you can see the plate sitting on the outside of the heel bone with screws. This picture here, this patient had what's called a trimalleolar ankle fracture, a fracture involving 3 different parts of the ankle, and you can see a couple plates, many screws, but once it's all fixed, the ankle joint looks really nice and symmetrically aligned. The picture here is an example of that Jones fracture that people treat with an intramedullary screw. So the screw is inside the bone and providing stability, but also allowing for healing to happen. And another type of injury along with the midfoot is called a Lisfranc injury. This is another fixation method for that. So I'm going to now focus the rest of my talk on preventative care. What can we do to avoid causing these injuries? How can we remain active as long as we can? How can we keep hiking for as long as possible? So with preventative care, one of the most important things that I emphasize to majority of my patients is the right type of shoe wear. What we put on our feet is our best defense against the environment and what's out there. So supportive shoes in general are good for foot and ankle hygiene. What I tell folks is thicker the sole, the stiffer the sole, the more support given. It provides cushion to the foot and allows for a more comfortable footbed to bear weight through. Like I said, less flexibility in the shoe or more rigidity in the shoe, the better. If you grab a flip-flop or a flimsy pair of flats and you try to bend it, it's really easy to do so. And all that motion that you're able to do in that shoe transfers into your foot. Vice versa, if you have a shoe and try to bend it and it's really stiff and rigid, that lack of motion does not get transferred to your foot, because if your shoe doesn't bend, your foot won't bend. So it decreases the stress across the joints and allows the shoe to do most of the work, frankly. So those shoes have a curved sole. You can see that here. This Brooks example has a curved sole, that rocker bottom. So even though it doesn't bend, you can naturally rock through the shoe and minimize the stress across the foot. And overall, over thousands of steps a day, many, many miles of hiking, that will make a difference. What you can do to supplement that are orthotics. So For most folks, whether you have a flat foot, neutral foot, or normal foot, or a high arch foot, the majority of folks over-the-counter orthotics will do just fine for you. There are custom orthotics that are out there, and I occasionally send patients to them, but for the majority of the time, it's patients that either have uniquely shaped feet or severe deformities. But every one of us, it's really easy for us to try a pair of orthotics on it. What I suggest is go into a running shoe store of your choice, an outdoor shoe store of your choice, trying orthotics on, see what works for you. The goal is to provide cushion support just like that rigid shoe or stiff shoe can do. You can supplement that by having different types of orthotics. But like I said, I would recommend trying some on. You're never wrong for wearing orthotics. It can only help you. If you find that you don't like it, all you got to do is to stop it. But in general, it provides you support and it decreases the stress that goes across your foot. A lot of the injuries that I mentioned before are rotational or twisting injuries of the ankle, and different types of braces or taping can help you. Now, if you go to a pharmacy, go to a store, go online, there's tons of ankle braces out there, and it's really sometimes overwhelming. You have to have that delicate balance between too stiff and rigid and painful, or too loose and flexible and does not provide any support. So this is an example on the left side of a really rigid and stiff one. It's called an air cast. And you can see it has two solid struts on either side. It's really rigid, oftentimes uncomfortable. The other end of the spectrum is this sleeve here on the bottom right where it's comfortable, it's form-fitting, it provides good compression, but you can still move your foot in every which way. So it doesn't provide a ton of support for you. So finding the right balance is important. One I typically recommend for patients is this kind of hybrid of the two, where it has laces in the front and Velcro straps on the side, where it's not too rigid and stiff that it's painful for most folks, but supportive enough to where if you were to have a twisting injury, at least prevents it from being too terrible and prevents it from being too bad. Taping is also not a bad idea. Taping is a little more temporary in terms of relief because as soon as the adhesive starts to wear off, then the taping isn't as effective. So it's important to, if you are considering taping, is to have someone who's experienced with it or feels comfortable doing it, to do so, because a poor tape job can just wear out within the first mile of a hike, and then you're left with essentially no support. But what I would say the most important thing or the most critical thing that you can do is some type of physical therapy, whether that's dedicated PT with someone at a clinic or an office, or your own home stretching, strengthening regimen. It's the critical part in both preventative care and recovering from injuries, either post-operatively or non-surgically managed injuries. After an injury, PT typically, I don't recommend doing it immediately. We want to calm down the inflammation first with either mobilization with the boot, anti-inflammatories, that type of thing. And once the inflammation has calmed down, we begin therapy. But at the end of therapy, most people graduate and then they start their own home exercise program. And that's the key here. So whether you had an injury that you went to PT for or you want to do PT preventatively, it's important to develop a routine that works for you and that you can do reliably and consistently to help loosen, stretch, strengthen your lower extremity, your foot and your ankle. One of the most common things I see and one of the most common reasons for foot and ankle conditions is tight calf muscles or tightness in the calf or the Achilles. And one of the easiest things to do is to do calf stretches every day on both sides. This is an example of a runner stretch or a gastrocnemius stretch, specifically focusing that muscle in your calf, where, as demonstrated here, 2 hands against the wall, front knee bent, back knee straight, both feet facing forward and leaning forward. That forcibly dorsiflexes your ankle, it stretches your calf. And hold that for 10-15 seconds. Do that on either side, 3 sets of that 3 times a day. That's a total of 2 or 3 minutes out of your day to do so, and you'd be surprised how much it helps you, because there are a lot of conditions in the foot and the ankle and a lot of injuries that can happen from having too tight of calf muscles. But calf stretching on top of other types of stretching, that's really going to allow you to maintain your activity level for a lot longer than you think. This is an example of a protocol that I put on there, and a kind of general protocol for recovery after an injury, and where PT kind of fits into it. So in the acute phase, like I mentioned, you want to protect the tissue during the inflammatory phase and not really aggravate it. So you control pain and swelling, manual therapies, different types of massaging and soft tissue management. You can try different types of electrical stimulation to stimulate blood flow, but the mainstay is ice compression elevation. During that immobilization phase, we want to minimize range of motion, but we also want to do some gentle range of motion actively to prevent that stiffness from coming on. In that intermediate phase, you focus on loading, progression, and more functional tasks. So you try to achieve that full range of motion, try to get your gait and your walking back to normal, focus on strength and balance, but you're not quite doing the higher intensity activities yet. That comes at the end, where once you've got your range of motion back and you're pretty confident in your strength, you start to then bring in the plyometric running, jumping, uneven surfaces, side-to-side movement type thing. There are a lot of fancy different types of PT things that our therapists work with, one of which is BFR, blood flow restriction, where by placing a temporary tourniquet on your thigh above your leg, what that does is stimulate a high intensity workout. So it deprives your muscles and tissues of oxygen and blood temporarily. So it's simulating kind of the last few stages of your hike at the very, very end of it, or last few stages of your workout. And that's where the meat and the bulk of a lot of the gains you can make in terms of muscle strength can happen. So it's one of the things that can potentially be beneficial for you in the physical therapy world. So to summarize, when you're out there hiking or before your next big hiking trip, really focus and take a look at what types of shoes you have. And if you find that, you know what, they're not as supportive as I thought they were, I would really consider getting a nice stiff pair, and different brands are out there. Most running shoe brands has a stiff variety supportive shoe. I would really investigate it. And, if this is your first time buying them, I would really go to a store and physically grab a shoe, bend it, try to see how rigid it is, because that's going to be the ultimate, the best way to make sure you're getting the right stuff. Like I said, you can supplement that with orthotics, same thing. If you haven't bought them before, I would recommend going to a store and trying them on. A daily stretching routine is immeasurable in terms of how much help it can provide. It's a very easy thing to do, and I know it's hard to incorporate that in our busy lives, but what I do myself and tell my patients to do is first thing in the morning when you wake up, spend 5-10 minutes, stretch, and all the tightness you accumulate from sleeping, it's really easy to work that out. And, it's before you get your day started and, the busy and hecticness of life before that catches up to you. First thing in the morning, I would do a daily stretching routine at the very least. If you're doing a lot of technical and difficult hiking, consider getting some type of support for the ankle, the foot, either bracing or taping, especially if you know you have a history of ankle sprains and this is something that you've been dealing with for a long time. Really consider bracing. There's some talk out there and people, consider bracing to be a negative in some ways. If you wear it too much, it can limit range of motion and potentially weaken the ankle. But for short-term things like hiking during athletic participation, it's a good injury prevention tool. And if you're not wearing it all the time, it's not really going to dramatically affect your strength or conditioning, but it's a great way to prevent an injury. Like I said, if you get injured, even if you're like, I'm not sure if it's bad or not, I would get an x-ray. It's a relatively easy thing to do. And just it's a good rule of thumb, it's a peace of mind to make sure you didn't fracture something, or if you did, then you need to do something about it. One of the worst things is if you had an injury that potentially could have been treated earlier, but then you didn't realize it until later, that's not a good feeling. And it just prolongs your recovery and it sets you back. But in general, most conditions improve with rest, improve with time. So the hardest thing to preach is patience here. So thank you everyone for taking part in my lecture. Again, I'm Aditya Yerrapragada, and at this point I'll open it up for questions.
Okay, thank you very much. That was a very informational overview of injuries and a lot of different ways to address that. And so we appreciate the talk tonight, Dr. Yerrapragada. Want to remind our audience at this time that we are accepting questions in the chat box, and we'll get to as many as we can tonight in no particular order. So, are there natural foods and supplements you would recommend to reduce inflammation?
Sure. So there are different types of diets that exist out there that can decrease inflammation, and there's some natural things that exist that could decrease inflammation. Things like turmeric, has been known to have anti-inflammatory properties. Same thing with avoiding things like gluten. That has been shown sometimes to decrease inflammation as well. So those types of things you can do. But in general, the inflammation is often generated by repetitive overuse, and those types of things, diet alone typically isn't enough to counteract that. So while day to day it can help decrease your baseline, when it comes to activity and hiking related injuries like tendonitis or other things, unfortunately diet's not quite enough. It's often the overuse from activity that causes this.
Do you recommend that the supplements be taken all the time or just when there is trauma or overuse?
So if you're talking about diet and dietary changes, that's more of a long-term type change. It's a sudden change in diet, I don't think will have that kind of immediate effect that you're looking for when you have a big sudden change in inflammation or an injury. That's what the medications like NSAIDs are for. Those are much stronger and more quicker acting than dietary changes and supplements. But it's taking supplements and dietary changes, that's more of a kind of a lifestyle change. So that would recommend doing so over a longer period of time and try to incorporate that into your day-to-day life.
Okay. So you had shown one exercise, stretching your calf muscle and your ankle. Do you have some other exercises that can be done to strengthen the ankles for stability, to prevent these injuries, especially while hiking on technical terrain, or maybe even a website that has that information?
Yeah, certainly. So for stability specifically, one of the best things you could do or consider doing or getting is one of those Bosu balls, which is the semicircle or hemispherical ball where it's a cushioned bouncy ball on the bottom but has a flat surface on top. And just by standing on it, first with 2 feet for balance, but by trying to force your ankles to balance on that ball, you're really working on the stabilizing muscles of your ankle. So as the ball slowly rotates, you're firing different parts of your ankle to really stabilize it. And as you gain confidence and strength in that, you can then advance it to standing on one leg. You can add weights to it. You can try to do other things while you're on it to really force your ankles into uncomfortable positions and force them to balance. Other things you can try is you can get a resistance band, and it's really easy to, while you're seated or laying down, throw a resistance band over your front of your foot, and then take your ankle and foot through a range of motion in different directions. And by going through each direction against resistance, that too will work on strengthening your ankle, different muscles of your ankle. But it's also never wrong to do something simple like go on YouTube, frankly, and say ankle stabilizing exercises. And there's a ton of content out there, but a lot of good stretches out there too. And see frankly what works for you, because not everything works for everyone. Everyone's a little bit different. So always see what works for you.
Okay. Does BCH have a therapy pool available to the public to improve feet and ankle strength while rehabbing?
You know what? That's a good question. I'm not aware of it, but they very well might. Most private physical therapists out there don't have access to it, and I know they don't have pools available. But you know what? I'm not sure, frankly, what BCH has, but it's something to look into.
Okay. May need a little help with pronunciation here. Does foot supination contribute to chronic foot pain and swelling after activities?
So I guess I'm not exactly sure what you mean by supination. If sometimes that's referred to foot shape. So if you've got high arches and as a result your foot kind of inverts this way, if that's what you mean by supination, then yes. So you are a little more predisposed to having ankle sprains if you have high arches, because you tend to walk on the outsides of your foot, and that you're on the way to potentially inverting or twisting your ankle. So that's where orthotics really come into play in supportive shoes, because you can then build an orthotic or build a shoe that prevents you from walking on the outside of your ankle, kind of flattens and stabilizes your foot better. So that's a consideration.
Okay. Do hiking poles really make a difference?
So fair question. Hiking poles are more for balance more than anything. So I don't necessarily think that they offload or rest your ankles. They certainly might in certain conditions, but for my purposes or my recommendation is it's an injury prevention tool. So especially on certain terrain, if that's what's going to prevent you from falling because you have two additional points of stability on the ground, then it's really beneficial to prevent a fall from happening.
Okay. Do you treat Morton's neuroma? And if yes, what is the treatment?
So I do, and I do see a lot of patients with Morton's neuroma. What that is for the audience is an inflammation and sometimes a growth involved in the nerves that runs between your toes. And the initial treatment is conservative. It's using what's called a metatarsal pad. Is something you put into your shoes, which offloads that part of your foot. If that doesn't work, the next step up is to consider a steroid injection. And if that doesn't work and you still have symptoms, then it's considering a surgery to remove that nerve. Like I said, initially, as most things, the treatment is conservative at first.
Okay. We still have some questions to go through, but we do want to remind our audience that we have time for more. So if you have more questions, please put those in the chat box for us. Thank you. Is there a particular brand compression sock you recommend?
There's no one brand that I say works better or worse than another. But one thing to keep an eye out for is when you do buy compression socks is that they have different grades in terms of pressure. So you want to, like with most things, you want to try them on because oftentimes I've had patients who purchase compression socks over the internet and they get home and it's very, very tight. And you want to understand what the different pressure measurements feel like. One way to try to mitigate that is instead of using a compression sock, you could try ace wraps. And there's thinner ace wraps that exist, and what that allows you to do is really dial in the level of tightness and compression that you want on your own. All you gotta do is unwrap it and retighten it. I don't have, like I said, a particular brand that I use, but I really think it's important to keep mind of the grade and the pressure gradients that exist out there because sometimes it can be too painful if it's too compressed.
Okay. What do you think about zero drop heel shoes?
So I have a lot of patients who do wear them. They're not as supportive as a lot of other shoes that exist out there. And I understand the premise behind it and trying to use your natural anatomy for it. Where I have difficulty with those is especially folks that are hikers but also trail runners is there's a lot of uneven surfaces out there that your foot has to navigate. And sometimes, especially in the longer distance athletes who do it for a long period of time, that you're just exposing yourself to potential risk. And what that risk would be, which is catching an uneven surface suddenly and out of nowhere, and you have that injury. And that one injury can derail you for whatever you're doing, if you're training for something or want to go further. So, I'm not against it, but I often don't recommend it for patients just because in general, those more supportive shoes that I mentioned are more preventative from injury-wise.
Can you recommend the best treatment for bunions? And is there anything to keep them from growing?
So, yeah, bunions are a little bit different animal here. And oftentimes people have a genetic predisposition for developing them. It's often also related to the types of shoes that you wear. More narrow shoes, dress shoes, formal shoes have that narrow taper in the front, which can predispose you to getting the bunions. The ways to try to navigate that are to get wider shoes. So unfortunately, the maybe less attractive, less flattering shoes are the ones that can accommodate them better, which are wider toe box, longer toe box to give your foot width to allow that bunion to breathe and not get so compressed. You can try other things like toe spacers, or yoga toes is a common brand people like, but they put space between the toes so that the big toe doesn't cross over as much. You put something in between the toes to space it out. But in terms of trying to prevent them, there's no great way, first of all, to reverse it. But your best bet in trying to prevent them is to wear those toe spacers. But what the studies have shown is that the moment you stop wearing them, it's just going to continue to progress. So there's no great long-term way besides trying to mitigate it by accommodating your shoe wear, trying to avoid those narrow shoes and toe spacers when you can. But it's if you stop wearing them, stop using them, it typically does progress. And the rate at which it progresses is a little bit different for everyone.
Does it have, do bunions have anything to do with your hip alignment or your leg alignment?
Sometimes. So most bunions don't. But there are some types of bunions that are related to malalignments or deformities higher up. Typically what I see when I do see that is due to knee malalignment. So if you have really knock-kneed or really bow-legged knees, then your feet sometimes have to accommodate that, and sometimes that manifests in a bunion. So people with bow-legged knees, they tend to walk on, your knees bow out this way. So in order to accommodate that, your feet try to accommodate the other direction. Same thing with knock knees. So not as commonly, but it can sometimes happen. At which point you have to address both deformities at the same time.
Okay. Is there any way to reduce swelling in the toes?
So there's swelling in the toes can be caused by a lot of different things. So it's hard to make a blanket statement about that. But if it is like in the context of this talk related to overuse or activity related things, the initial thing is to rest, which is, or rice, resting it, icing it, elevating it, and doing some compression. Now, there are other types of swelling that you can develop in the toes due to other reasons. If you have other issues related to the heart, where your heart doesn't pump as much blood, you can develop swelling and edema in the toes and the feet. So it really does depend on the type of swelling you have. But if it's activity related, the resting, icing, compression, elevation, that's going to be your best bet. You can also work on range of motion, the toes, to try to squeeze the fluid out as well. But the standard rice is going to be your best bet here.
Okay. This is a little specific, but we'll go through this. This person has extremely high instep and high arch. They're collapsing as they get older. So they can't hike because it's painful and unstable. Any suggestions for how to help that?
So the first thing I would suggest is really examine the shoes you wear. And if you do wear orthotics, examine those orthotics. And if you don't, consider orthotics, because, there are arch support style orthotics that can prop the arch up and help prevent that from collapsing. Oftentimes with collapsing arches, you have associated tendonitis. So if you're having pain on the inside or medial side of your foot and ankle, it's usually because of that posterior tibial tendonitis I mentioned before. It depends on how long this has been going on for, but things you can do in the acute phase are immobilization, which is with a boot or a brace, resting it. But over the long term, really examine the shoes that you wear and the orthotics that you use, because that can help potentially prevent it from getting worse and help support your foot better to allow you to remain active.
What is the least invasive procedure for arthritis in the ankle? And are there any exercises that would help keep the ankle strong for walking and hiking?
So arthritis of the ankle is a little tricky animal to deal with. So just like with sprains, there's a wide spectrum of arthritis in terms of it could be early on. If it's early stages of arthritis, then you can get away with not doing a surgery, doing the things we mentioned before, bracing, supportive shoes, anti-inflammatories. As it progresses, you can do things like injections of cortisone or steroid to help decrease the inflammation temporarily. But ultimately, if the arthritis progresses to the point where you're considering a surgery for it, there's not a lot of minimally invasive options, because if the arthritis is bad enough, then you're looking at two main options, which are a fusion surgery, which not a lot of people do as much anymore, but some people still do, or ankle replacement surgery. And those are going to be two main options. And as of now, there's no great minimally invasive option there. Now, if you have arthritis that results in bone spurs and your spurs are what are causing your pain and symptoms, then there are arthroscopic surgeries, which are small incisions and minimally invasive that you could do to remove the bone spurs. But it just depends on the severity of the arthritis that's involved.
Okay. But there are some options, though.
Correct. It just depends on the severity of your arthritis. If it's progressed past the point, the minimally invasive options won't do you much good. But if it's still relatively mild and it's bone spurs that are causing you pain and impingement, then there are arthroscopic or minimally invasive options that I treat you with.
Okay, and that's worth a visit to you, right?
Certainly, yeah. If you are unsure or not quite clear on what those options are, or not sure what types of arthritis you have, the easiest thing to do is come on in and we'll get an X-ray and we'll chat.
Okay, perfect. So you mentioned rice a lot, and you often hear of alternating heat and cold, especially for when the injury initially happens. Can you elaborate why it's ice only?
So typically in the acute phase of inflammation, when you're trying to decrease the swelling, the ice really helps contract the vessels that are providing blood flow there. Heat is a vasodilator. It can expand the blood vessels, and that increases the blood flow into that area, which can be helpful if you're about to start or resume an activity. But right when the inflammation happens, you kind of want to cut off that inflammatory pathway temporarily, of course, to decrease the swelling. So that's what ice really helps in the acute phase in the beginning. But as you're starting to get back to activity over the several days or weeks, then heat can warm things up and loosen things up a little quicker for you.
Are you familiar with the Toe Pro? And if so, the thoughts for building toe strength, especially the big toe?
You know what? I am not familiar with the Toe Pro, but if it is what I think it is, I'm sure it's a device to work on contraction and flexion of the toe flexors and the toe muscles. Certainly something to do. There's never, in my opinion, never anything wrong or bad with trying to work on getting more strength or getting more range of motion. So it's certainly, I don't think something that's going to hurt you, but I'm not specifically familiar with that.
Can sciatica pain put stress on the ankle?
So sciatica pain is inflammation and impingement of your lumbar spine or lower back, causing pain that usually radiates down the back of your back of your buttock, back of your thigh, into your leg. It isn't a mechanical symptom, it's a nerve type symptom, so it doesn't necessarily increase the mechanical stress on your ankle, but you may have ankle pain, which is nerve related, which are kind of different things. So I don't know that it would specifically increase the mechanical stress on your ankle, but you may have ankle symptoms from the nerve inflammation and irritation related to sciatica.
Okay, thank you for clarifying that. With partially torn ligaments and a non-displaced ankle fracture, does weight bearing make the healing process slower?
Not necessarily. So it ultimately depends on where the fractures are. But if I assume that it's in an area that's a stable fracture that is safe for weight bearing, then no, you're actually, what the studies will show you, that weight bearing does not displace the fracture or injure the ligaments. And it's actually beneficial, because the trade-off is, if you were to go full non-weight bearing, yes, that does decrease the stress across the ankle, but it really significantly weakens the muscles around your ankle. So while it may heal your ankle and your ligaments, but your recovery and rehab on the back end after that period of non-weight bearing would be slower, because you need a lot more time to build up the ankle strength. So that's why the trade-off exists, and that's why we're a little more aggressive nowadays than we used to be 30 years ago. We used to cast people, make them non-weight bearing on crutches for a lot of injuries. Now we've realized that it's actually safe to bear weight and allows you to get back to activity quicker, because that muscle strengthening phase is much shorter if you're weight bearing earlier.
Okay. Are there non-surgical options for dealing with a big toe neuropathy? It curls up and aches.
So neuropathy is also a difficult animal to treat, and that's because it's a nerve-related condition. And neuropathy can have a lot of different causes and factors. The most common is just idiopathic, which is just without an obvious origin. Or actually, I take that back. A common one is diabetes, diabetic neuropathy. But the issue is with neuropathy, it's a nerve degeneration, and there isn't a lot of great options when it comes to reviving or healing nerves. So there are some medications out there. A lot of them just dull the neuropathic pain, but not a lot can be done to reverse the neuropathy once it sets on, unfortunately.
Okay. If you have shoes that are putting pressure, say on your baby toe, your little toe, should you, what's your recommendation for that?
It's just like the bunions where you want to get wider shoes. So pressure on the small toe is often what's called a bunionette, so a bunion on the other side of the foot. And wider toed shoes are what's going to be best for you to minimize that discomfort and decrease the pressure on the small toe.
Okay. What is your opinion on stem cell treatment for joint issues?
So when it comes to joint conditions, there isn't a lot of great literature or evidence to suggest that either stem cells or platelet-rich plasma or PRP does a lot of benefit for you. Joint-related conditions are most commonly arthritis or cartilage loss, and like I said, a lot of studies show that it doesn't do a great job of regrowing cartilage. Now, there's other parts of your body that PRP or other stem cells type treatments can help you, and those are usually tendinitis, things that like the elbows, the hip, sometimes the plantar fascia, the Achilles in different places. But unfortunately for joints, we don't have a great way of regrowing cartilage, and there's not a lot of great literature or evidence out there to say that those types of regenerative treatments works for joint conditions.
Time to squeeze in a couple more questions, and we'll be done here. Is PRP a good option for chronic inflammation of the tendon?
So yes, it can be. So there are always subtleties when it comes to medicine. So there's different types of tendinitis that PRP works well for. Things like mid-substance Achilles tendinitis, which is not at the insertion of it, but a little bit higher up. That can be helped by PRP, and there are some studies out there to show that it can. Same thing with plantar fasciitis. There are some studies out there to show that it can be beneficial. But it really is kind of case by case dependent, and it depends on where your pathology is, but it can be beneficial.
Okay. Does bracing the ankle transfer the stress to the knee?
So, not that I'm aware of, not necessarily. So, the way I would potentially see something from the ankle causing issues in the knee is if it were to significantly change your alignment. So, if your ankle alignment was dramatically changed or altered, it can cause issues above in the knee. But with the brace, it doesn't necessarily change your alignment; just minimizes motion in the ankle. So, in that way, I don't see that it would cause necessarily increased stress in the knee.